The Whipples pancreaticoduodenectomy is a major abdominal surgery which is performed for pancreatic cancer. The Whipples is done not just for pancreatic cancer but for a group of tumors called the periampullary tumors, which include tumors of the head of the pancreas, the bile duct, the duodenum and the ampulla. All these tumors occur at the area of the head of the pancreas, which is a very critical structure because in the sense that at the head of the pancreas, the gallbladder, bile duct, the pancreatic duct, the duodenum and the head of the pancreas, all these structures converge into a single unit. So when a cancer occurs to any of these parts, we would need to remove the entire unit of including the head of the pancreas, the duodenum and the bile duct and the gallbladder and make 3 new connections. So this is why the Whipples operation is done. The Whipples pancreaticoduodenectomy is obviously a very major surgery. It has its own risk of surgery. The early postoperative mortality is about 2 to 3%. That means if you do 100 Whipples, about 2 or 3 or sometimes 5 patients out of that die in the early postoperative period because of the complications of the surgery. But once you are beyond the early postoperative phase, let's say 2 weeks after the surgery, the long-term quality of life and outcomes are excellent. So in terms of after Whipple surgery, the patient can get back to his life as usual. He can get back to his job, get back to normal physical activity. He can eat and drink everything without any problems. Usually these patients, we put them on pancreatic enzyme supplements and calcium, which are basically supplements, not even medicines. So other than taking these supplements and coming for regular checkups, the quality of life after Whipples long term looks very good. The other question that comes to the mind is, what are the long-term outcomes of this patient after Whipple surgery? That means, how many years do they survive? Obviously, Whipple surgery is most of the time done for cancer, and the long-term outcomes are determined by the cancer. That means the stage of the cancer. You have stage 1 to stage 4. Usually stage 4 we don't do surgery, but stage 1, 2, 3, as the stage increases, the outcomes worsen. Likewise, do you have vascular involvement? Is there lymphatic involvement? Is there lymph nodes involved? What is the grade of tumor? Is it a very aggressive kind of tumor or a less aggressive tumor? The grade of the tumor and also the type of the tumor. Some tumors like neuroendocrine tumors have better outcomes than adenocarcinoma. Overall, as a group, if you look at the pancreatic and periampullary cancers for which the Whipples is done, the carcinoma head of the pancreas and the bile duct tumors have a poorer prognosis. The 5-year survivals are about 50% in these group of tumors, while the other periampullary tumors, in fact, which are more common in India, the duodenal, the ampullary and the neuroendocrine tumors, which they have usually very good outcomes, about 5-year survivals about 70 to 80%. Yes, the Whipples can be done laparoscopically or robotically, but we do it in very selected patients who are fit for surgery per se, because the Whipples is a very major cancer surgery which takes about 4 to 6 hours. The advantage, the laparoscopy obviously prolongs the time, and so only patients who are young and very fit, who are not very obese, who can tolerate a slightly more prolonged surgery are fit for laparoscopic or robotic surgery. The Whipples procedure is a major abdominal surgery. The usual duration of surgery lasts anywhere between 3 to 6 hours when done by open, and when it's done by laparoscopy or robotic, it can last anywhere between 4.5 to 8-9 hours. Obviously, the technical difficulty and the time taken depends on the expertise of the surgeon, the build of the patient, obese or thin patient, the type of tumor, how locally advanced and how easy it is to resect. All these factors determine the surgery. But all said and done, Whipples is a time-taking surgery, so a thorough preoperative evaluation to assess the fitness of the patient has to be done before doing the Whipples procedure.